from your estimation and in reading the report, there were several really interesting little factoids. But I'm curious, just based on your read, what do you think are some of the primary drivers behind these rising health costs? That if we're going to focus an effort on bringing down some of these costs, where should we be looking?
Yeah. Well, before we talk about, how to impose a budget constraint, right? It's funny, you think, what's a healthcare budget? That means setting a spending target at the very least. We don't do that. Before we talk, and other countries do, before we talk about how to do that, let's dig a little bit into the drivers. The first big driver is demographics, right? The population is aging. As countries move through what we call the epidemiological transition, right? From it's mostly infectious diseases that kill people to it's mostly chronic diseases. Well, the elderly are much more likely to suffer from chronic diseases than the non-elderly. Therefore, they consume a lot more in healthcare services. In the United States, for acute care services, it's nearly 3 to 1 per capita, right? Elderly to non-elderly. And for long-term care, it's 20 to 1. So the elderly consume a lot more in healthcare services. The elderly are the fastest growing segment of the population. The older the elderly are, the more healthcare they consume. And the oldest elderly age brackets, 80 plus, 85 plus, are the fastest growing of all. So you put those multipliers together, both the increase in the total number of elderly beneficiaries in federal programs and the rising average age of the elderly, and you get a big impetus to health. You get a big push to healthcare spending. The CBO calculates that overall, between now and 2050, demographics alone account for about a third of health benefit spending growth. In Medicare, it's closer alone, leaving out Medicaid, which also includes younger people and children, right, as beneficiaries. It's closer to 50%. And that's really important, because what that means, think about it for a second, what that means is you need about a third of projected spending growth just to keep delivering the same services that you're delivering today, okay, at each age to each beneficiary. That's almost baked in the cake. So what you want to be looking at is the other 70%, which is sometimes called excess cost growth. And what excess cost growth is the extent to which per capita healthcare costs at each age are rising faster than per capita GDP. And what's that driven by? We'll come back to the vast amount of waste in the system in a moment, but I don't think the growth, right, is being driven by the proliferation of pure waste. It's being driven by advances in medical technologies, right, that drive up the capital and labor input costs for all the healthcare services we consume. It's being driven by rising public expectations about care and cure. We expect a hell of a lot more from the healthcare system, both in terms of quality and quantity, than we did 30, 40, 50, 60 years ago. Healthcare is becoming this lifelong process of diagnostics and fine-tuning, in which no extra dollar spent might not have, at least to someone, some perceived benefit. And that kind of brings us back in a way to the whole waste myth. It's a lot easier to identify pure waste in theory than it is to identify it in practice.